gone for your prostate screening today? How about your pap smear? These and more are what we're going to treat on today's show. So please, when we're done, just run to the hospital and go check it out. Sabi doctor, do you want to tell them more? Okay, let me not put him on the spot. We're actually discussing STIs, and you know the checkups are what helps you and make sure that you're running fine. So let's start with the most common ones: the gonorrhea, the chlamydia,
Okay, so in case you are just hearing STI for the first time, it means sexually transmitted infections.
or
You know,
diseases.
some people call it STDs, sexually transmitted diseases. In very simple terms, it means infections or diseases that are spread primarily
Through sex.
through sex.
Any kind of sex.
Any kind of sex, be it oral, vaginal,
Anal.
anal, breast
Yeah.
sex, whatever.
True.
So far, it is through sex. It's a sexually transmitted infection. Mind you, there are some infections that are equally sexually transmitted and transmit via other route as well.
Yeah.
Okay, so it's important you make that distinction. The most important thing is the primary route of transmission is through sex.
Okay.
So those are STDs, and we have several of them, hundreds.
Before we go into that, something just crossed my mind. We always hear this thing called toilet infection.
Yeah.
And I've had this conversation before, and a doctor friend told me that there's actually nothing really called a toilet infection.
There is nothing called toilet infection. It's a misnomer. In fact, it's a Nigerian terminology.
And condition.
So if you go to this, there's nothing called toilet infection. In the books, nothing called toilet. It's just a Nigerian thing. Okay. Most times when people talk about toilet infection, what they are referring to is vaginal yeast infection. Okay. And from what we know, maybe when you use contaminated toilet, that may predispose you to developing a vaginal yeast infection. So the way it works is, if, for example, somebody maybe uses a toilet and the person maybe has the infection at that point in time, and let's say you go to pool, and as the pool drops, the water splashes, comes in contact with your vulva and the likes, that may predispose you to having a yeast infection possibly. But then it's the way people blow it out of proportion. That is not really the primary, risk factor. The women who are washing their vaginas. I'm talking about the vagina now, not the vulva. Okay, you can wash the vulva, but not the vagina.
That's so the vagina from the vagina
where
opening
the
and then going in. Yes.
That's where you should not wash that place.
Yeah, because it's self-cleaning.
You get now. And then there is the issue of antibiotic abuse. Practically every infection pushes women to seek antibiotics off
over the counter.
Yeah, over the counter. But then these are antibiotics that require prescription. So that's a factor, because we have good bacteria in the vagina and bad bacteria. When you take antibiotics,
it kills everything.
It kills everything.
It doesn't select.
All right. So the STIs, you can group them into those that are caused by bacteria. So you have bacterial STIs, you have viral STIs. The most common ones are caused by bacteria. So for example, gonorrhea. Okay, you have gonorrhea, you have syphilis. All right, those are like primary. You have chlamydia. Those are very common, And the thing there is, these are infections that sometimes can be very silent, especially in women. So a woman may be with gonorrhea for 5 years and not know that she has gonorrhea.
No symptoms, no nothing.
And by the time,
breeding.
In fact, most times before she discovers it, is when probably she's trying to conceive and she's not able to conceive. She goes for a test and realizes that her tubes are blocked. The infection has, caused scars within, blocked her tubes.
Wow.
So most times that is the stage where the infection, and at that point in time,
I also
it's
heard
really, really bad.
that such things when the infections or when the bacteria are in the canal, it can cause blindness during childbirth.
Okay, so yeah, if there is an ongoing infection and the child picks it up at that point in time, yeah, maybe rubs the vaginal fluids, enter the child's eyes and all kind, it can lead to infection, which may affect the eyes, and if treatment is not, started on time, it may cause very damaging complications.
Okay.
So most times, how we know that a woman has maybe, so for example, gonorrhea, chlamydia, is when the male partner comes to the hospital with symptoms of gonorrhea. Then we have to trace, we have to do contact tracing, like, okay, who are your sexual partners?
Because even if he treats himself and those people are not treated, he could
goes
go back
there,
and reinfect himself.
And again, you are also doing it for the person as well, because if the woman does not know, she lives with the infection for a very long time.
Another thing that they even tell you, or tell us women, not you, sorry, is when you think that you have an infection, maybe you have symptoms and stuff, do not use tampon. Because if the infection is like the end or the edge or the canal, the tampon, like penis pushes it in, and then it goes further in, close to the womb, close to the pelvic and everything. So just be careful. If you notice that, don't use tampon. Revert to other. Don't use tampon. Don't use those cups. Anything that you're inserting.
In fact, essentially, don't let things allow. Don't let things, animate and inanimate objects inside of you until you are
sure and you're in the clear.
Yeah.
Please go on.
So yeah, those are the bacterial ones. But you should know that some of them can also spread through oral sex.
Yes.
Same as anal sex. In fact, the risk of spread of HIV is almost 4 times higher in gay people, or people indulge in anal sex than normal usual sex.
True.
Because of the lining of the anus is very thin, allows for easy spread of
tear.
Yes, and tear.
Especially not properly lubricated.
That's why you see the incidence is quite high there. Okay, so some of them can spread through oral sex. For example, herpes. Or herpes is a bacterial one, a viral infection. I'll come to it.
And it has no cure.
Okay.
Right?
Gonorrhea.
Which one has no cure?
Herpes has no cure.
All right.
So gonorrhea can also spread through oral sex. So it can cause oral gonorrhea, can affect the throat. Okay. So these are some of the things you need to. So it's important that once you notice that you have it, you abstain from sex. Get yourself properly treated before you go back. To it. That's for the bacterial one. Then you now have the viral. Viral are caused by viruses. Most of them have no permanent, permanent cure. You can only manage their symptoms and probably there is an outbreak. For example, herpes. All right. HIV is another one.
What is hepatitis?
Hepatitis 2 can actually also spread through the virus, because hepatitis means inflammation of the liver. The liver is maybe undergoing a phase of injury. Okay. Sometimes drugs can cause it. Alcohol can cause it. All right, it can cause hepatitis, but this one is being caused by a virus. So there's a hepatitis B, hepatitis C, hepatitis A, even D, E. Yes, various types. Was the common ones that cause problem. The C.
Sorry, the A, B is like vitamins, but like with disease. Sorry. Please go on.
So there is the B and C are the ones that usually cause problem. Yeah. Particularly the B.
And very
because
infectious.
There is no cure for it. So the B and the C, they can also spread through exchange of bodily fluids.
And sharing of toothbrush.
You get that essentially. So the bodily fluids now, that sex still comes into play here. So you can contract hepatitis B. Those are also viruses. Hepatitis B virus. You mentioned herpes. Then there is HPV, the human papilloma virus. That's the one that is implicated in cervical cancer. It's also implicated in cancer of the penis. It's also implicated in anal cancer. All right. So the virus can spread. Can spread to the anus, can spread to the cervix, cause a lot of damage. So the thing here is the HPV virus is also known to cause genital warts. In fact, that's usually the commonest, infection that the disease, genital warts, if you have seen it.
And to note this here, this is very, very key. Genital warts, you can get it whether you wear a condom or not. So as long as is on your like the upper thighs,
same thing
and
with
everything.
herpes,
Same thing with hepatitis, I believe.
Yeah, because those are diseases that are found essentially on the skin. So you don't, except you are covering the whole of your your groin, everything with balls.
And I don't know how you want to do that.
Because sometimes the warts, can be on the ball, on your testicles.
Yeah.
Can be there, or it can be on the groin, or it can be between the space between the testicles and the anus. It can be it can be in the anus as well. So, if you are, having body contact with that particular portion of it, you can pick it. Okay, so there are certain infections that condoms don't offer protection.
You from. Exactly.
Okay. Most times, what condoms does is the infections that are carried by seminal fluids and vaginal secretions
and blood. I believe.
Essentially. So that's how it works. So you have the herpes. Herpes has no cure. All right.
But there are preventive shots. Is for hepatitis. I know there are
hepatitis.
Preventive shots.
There is
HPV.
a vaccine. For
I heard for HPV, I think there are like 3 shots you take
there is a HPV
per
vaccine
month or something like that.
There is a HPV vaccine you can take, or that gives you cover, protective cover.
Which means you don't have it, like you did not have it before you took the injection.
Yes.
Not that you already have it and you didn't know and you took the injection.
So that's why it's important before you take the vaccine, do an HPV screen. So it's not just the cervical cancer screen. You are not doing only cervical cancer. You are doing, I'm talking about the pap smear. You are not only doing pap smear, you are also doing the HPV. You test your blood to see whether there are antibodies against the virus. So if there are already antibodies, to a large extent, the vaccine you're going to take,
you're just wasting money.
Essentially wasting your time. Okay. But if you don't have it, then you can take the vaccine. It offers protection against the strains of the virus that cause genital warts and cancer.
Agreed.
So that's how it works. So you take the 3 doses, preferably. In fact, what we now recommend is that parents should encourage their teenage daughters and boys to get the vaccine before they become sexually active.
Oh.
All right. Before they become sexually active.
This is why we're having this conversation. This is why we're having these talks, because people don't know this. They feel but he has not. How old is he? He's like what, 12? He's like 15. There's nothing happening. Why am I? But they don't understand that it is necessary. So this is the reason why we're having this conversation. So parents out there, please listen to this, watch it, become open-minded and want to know more. Take your kids, know their medical history, and do the right thing by them. They will thank you later. And you yourself, you need grandchildren. You need your parents, you need your children to bury you, not the other way around. So please, thank you.
So that's that about the HPV. So if you get the vaccine, get some cover. Herpes has no vaccine, it also has no cure. But to a very large extent, it rarely causes fatality. It doesn't kill, at least an adult, but it can kill the newborn baby if the baby picks it up during delivery or even after delivery, but within that neonatal period, first 30 days, So that's why we advise that when people are coming in to greet the mom and all, avoid too much of touch or kissing and you get now. Allow the baby to get beyond that.
For the
immunity should have been, Otherwise, if the baby picks it up at that point and there is no sufficient care given, the baby can die. Otherwise, adults rarely. I've not seen a case of an adult dying from herpes.
You know how HIV, those drugs to reduce the viral load.
Yes.
Do they have? Is there something like that for herpes?
Yes, there is. There are drugs. Antiviral drugs, particularly for that. In fact, one way we manage the infection is that at intervals, you are supposed to take the medication, even when you are not having an outbreak of blisters.
Okay.
All right. So, for example,
you don't wait for that.
You don't wait for the blisters to So for example, you could be doing it every 3 6 months. You take a course of you take that, you bring down the viral load, assuming that the viral load is rising up. When you do that, it crashes it down to a level that will not cause outbreak of blisters. But again, if you are sick, let's say you have malaria or you have other stuff that weaken your immunity, usually those are times that you have outbreaks. Some people can be lucky, 5 years, no outbreak, okay? But maybe they get sick, they are too stressed, or something happens, their immunity is a little bit down, an outbreak comes up.
Okay, so let me clarify. Let me ask so that you can clarify for our audience. During the time when they don't have any outbreak, they cannot infect. Yeah, so, exactly.
The risk of infection at that point in time is very minimal.
Okay.
Usually, the infection spreads when there is an outbreak, because those blisters, those painful blisters, fluid-filled blisters, they contain loads and millions of viruses. Yeah. Okay, if you come in contact with it, even you yourself, somebody has it, the person can pick it from the genital area to other parts of the body. Highly infectious.
Yes, true.
Very, very infectious. So when you have an outbreak around the time of delivery, they might opt for CS to deliver the baby and all. So that's for herpes. Mentioned HPV, HIV. We all know about HIV.
Yeah, but I also want to add that for HIV during childbirth is CS. You're not advised to do.
Okay, so there are two schools of thought. All right, some people say, okay, let's opt for CS and all. But from what we know, essentially, if the woman is on HERT, that's the drugs. All right, she's taking her drugs. The viral load is very down. She can undergo vaginal delivery. Okay, she can. Some doctors will say, okay, let's do CS. Some say, no, the viral load is quite down. Let's allow the woman to deliver vaginally. Whatever the case is, there are guidelines to follow after delivery. For example, once the mom is HIV positive, within the first few days of delivery, the baby is started on
drugs.
Okay, that's done so that even if the baby gets, in fact, the baby is already exposed, but we don't know the extent of the degree. If the baby gets exposed, the drugs that give the baby at that point in time, reduces the chances of the baby becoming infected.
So is it similar to what they give? Is it similar to what they give rape victims?
Okay, that rape victim, they call it.
I can't remember the name now.
Not only the rape victims. If you suspect that you are exposed to the HIV virus, if within 72 hours you take action, there's something we call post-exposure prophylaxis.
Thank you. I was trying to remember the name.
Post-exposure prophylaxis. So if it's within 72 hours, you get access to it. Even if you are exposed to the HIV virus, if you take it consistently, about 28 days, it reduces or eliminates any virus that would have established as a proper infection. Okay, so, but then the way it works, essentially with the baby, the baby has to sometimes be on need for like 6 weeks. Wow. So it's a bit different from the PP. It's different, Give them nevirapine.
I think we've covered the major ones.
Yes.
Maybe just quickly, do we do fungi? Is there any major fungi? So you could just
let me mention the protozoa. For example, scabies. Okay, scabies is also an STI.
Really?
All right, yeah, genital scabies.
Oh, yeah. Okay, sorry, when you said scabies, I heard rabies.
No, scabies. And they also sprayed, you get now. Very, very, very distressing infection. The mites, we call them scabies mites, okay? They infect the genital area, the skin, of course, and it causes intense itching, especially at midnight. They wake you up. Wow. So if you have it by midnight, they'll wake you up. No. The itching is very distressing. You want to get help. It's that serious. So you itch all through the night. Okay. So that also can spread, through sex. Now, bacterial vaginosis, yeast infection, those are not the STIs. Okay, but having sex with multiple sexual partners can increase one's risks of getting, that infection. And they also, once you have them, they can also increase your risk of getting STIs. So if you have,
because
for
your
example,
immunity is low,
if you have, for
all
example,
those antibiotics and whatnot.
If you have, for example, bacterial vaginosis, and you are not treating it, it can increase your risk of getting, for example, gonorrhea.
Wow.
But they themselves, they are not STIs. You don't, have to have sex.
Okay, so because we don't really have much time, let's just quickly touch on the checkups.
All right.
As brief as possible, pap smear.
So pap smear.
Prostate.
Pap smear is very important. Okay, mostly for women who are sexually active. All right. Sometimes they say you should start doing it from the age of 21, but if you have started knacking,
by that he means having sex. Knacking is Nigerian lingua.
All right.
Okay.
If you started having sex, okay, you can as well go for it. The fact that you're not sexually active does not mean you cannot take the test if there are other risk factors. But our emphasis is majorly on people who are sexually active. If you're 40, you're not sexually active, but you have risk factors. Maybe your mom,
or 35,
or your mom has it, or a sister has it.
So it's hereditary.
You already have the familiar risk factor there, so you can go for it, because you would not need to get HPV before you develop it. There are still instances where the disease can develop without the presence of HPV, even though HPV is the number one primary risk factor for the disease. So pap smear is very important. To add again, there's something we call HPV screening. Okay. This is different from pap smear. The pap smear tests for cancer cells. Okay. The HPV screening tests for the infection, the virus. So do you have the virus inside of you? That is what the HPV screening does, and it's a blood test. It looks for the antibodies. So if you have the infection, your body would have produced some antibodies. So that particular test looks out for those antibodies. If it's negative, you can go for the vaccine. All right, but if it's positive,
there's no need.
Really, the need is lost. Okay. So you're doing cervical. The pap smear, you're doing it, and you are also doing the HPV screening before you get the vaccine. Very important. That's for women. But in addition, you can also go for other STIs screening. For example, the bacterial STIs. You can get screened. For example, syphilis. You can do a blood test for syphilis. Okay, so these are tests that should be done routinely if you are sexually active. You don't have to wait until you have symptoms. For example, once every year, if you're sexually active, you can go and get an STI screen. Okay, mind you, once you are above 30, the vaccine, the efficacy is usually very diminished. So if you want to get it, best time to get it is under 30. Okay. Under 30.
How about the prostate screening?
So the prostate, there are two types you can do. You can do what we call PSA. Okay, so PSA is prostate specific antigen. Is a protein, all right, that is produced by the prostate, the cells of the prostate. Okay, usually they have a normal range from 0 to about 2.5 nanograms per ml. All right, and as men age, it keeps rising. Now the thing here is, it gets to a particular level where you start suspecting prostate cancer. All right, so if you are doing the test frequently and you discover that maybe this thing has gone beyond, or it has gone beyond 4, the value has gone beyond 4, you start suspecting a case of prostate cancer. So between that time and between 4 and 10, you have a 25% risk. Above 10, you have a 50% risk of having prostate cancer. There is also the manual examination of the prostate, where the doctor puts the finger in the anus,
the most
rubs.
inconveniencing
Yes, some men like it. Some men like it.
But some men like it. Wow.
That's the P sport.
I'm not here. It wasn't me.
That's the P
I'm
sport.
not
they call
here.
it the P sport. Some men find
There's stimulations. It's like an erogenous spot too.
So you can do the manual stimulation, examination, or you can do PSA.
And what you're looking out for
is
bumps. So that's what you're looking out for to know if, and then you can find out if it's malignant and things like that. So, but before we go, he has this for you. This. Oh yeah. Which one do you want to talk about first?
So this one, a medical guide to marital sex and intimacy. Okay. Essentially, it talks about sex in the marriage context, right? And it gives couples guidelines, basically, how to do, what to do.
Everything we're doing here is all shrunk into this. And then this is also A to Z of how to maintain a healthy, fresh, and tight vagina.
Very tight vagina.
Don't know about that one though, but
so yeah, this one is.
Where can we get these books?
Okay, if you go on my platform, you will find information at The Real Savvy Doctor on Instagram.
So you see the information there, how to get the books. Please order. This would make your life so much easy. This will show you what to do, what not to do, and how to find the vagina. Apparently, some people think it's missing. So
men can actually also read it.
Please, men, read it.
So
women, read it. Thank you. If you have teenage kids, you can also read the vagina health, not the marriage. There's a certain age for that. So thank you so much, Damian, for coming. Thank you so much. And I just wanted to add 2 things. If you're having sex, immediately you have sex, pee. That helps reduce your
risk of UTI.
Exactly, reduces the risk of UTI, and also wipe from front to back when you pee or when you poop, so that the germs are not introduced to the vagina. And then one more thing, if you're going to poop and you don't want splashes, put tissues in the bowl, toilet bowl. It reduces the splash, and then you don't have all what they call toilet infection. So these are my tips for you today, and I hope you have an awesome day and it has blessed your life. Thank you so much. Signing out from Get Intimate with Ebele. Love ya. Bye.